ADHD, also known as attention deficit hyperactivity disorder, is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems, such as difficulty sustaining attention, hyperactivity, and impulsive behavior. Children with ADHD also may struggle with low self-esteem, troubled relationships, and poor performance in school. There are more than 3 million cases per year in the US alone of ADHD, mostly among children. So let's talk about this disorder. Hello classmates and possible other viewers. My name is Abir Hussain, and today we are going to talk about the disorder ADHD, also known as Khalil. But in all seriousness, this is a very common disorder with over 6 million diagnosed patients. So let us look at what makes ADHD what it is. So what causes ADHD? While doctors haven't come with an exact cause of ADHD yet, there's been research done to find out more about it. Doctors say that certain factors may increase chances. Here are just a few. Genetics. Doctors have conducted studies that have shown that ADHD can run in families. So if you know of a close family member who has ADHD, there's a good chance of you or your children having ADHD in the future. Also, studies have indicated that specifically genes in our DNA may play a role. Environmental. Doctors say that certain environmental factors, such as high exposure to lead or other toxins, may cause ADHD, as it affects the functioning of the brain. So it would be a good idea to make sure to avoid this. Maternal drug use. The mother's use of drugs or other alcoholic substances during pregnancy may affect the chances of ADHD. Developmental. Problems during times of key developmental stages in early life, such as a brain injury or another disorder affecting the central nervous system, may boost the chances of ADHD. As you could probably already tell, ADHD affects the central nervous system, specifically the brain, which is a key organ for the body to work properly. The disorder mostly affects the behavior of people. ADHD symptoms can start before the age of 12, and in some children, they're noticeable as early as 3 years of age. ADHD symptoms can be mild, moderate, or severe, and they may continue into adulthood. There are 3 subtypes of ADHD, predominantly inattentive, which means most symptoms fall under lack of attention, predominantly impulsive, which means most symptoms fall under hyperactivity and impulsiveness, and combined, or both, and this is the most common. There are many symptoms of ADHD. Some may include inattention, which can be failing to pay close attention to details or make careless mistakes in close schoolwork, have trouble staying focused in tasks or play, appear not to listen even when spoken to directly, having trouble organizing tasks and other activities, and being easily distracted. Hyperactivity, which can be often squirming, fidgeting, or bouncing when sitting, doesn't stay seated, has trouble playing quietly, and talks too much. Impulsivity, has trouble waiting for his or her turn, blurts out answers, and interrupts others. The ways to prevent ADHD is easy to do and should be done while people are in early stages of development and during pregnancy. These include not using drugs, drinking alcohol, and avoiding smoking during pregnancy for mothers. Also, for parents to make sure that children have a balanced diet and making sure that their child does not get any serious head injuries. While there are no cures to ADHD as of right now, there are, however, treatment that may help manage inattention and hyperactivity. Currently, stimulant drugs called psychostimulants are the most commonly prescribed medications for ADHD patients. Stimulants appear to boost and balance levels of brain chemicals called neurotransmitters. These medications help improve the signs and symptoms of inattention and hyperactivity, sometimes effectively in a short period of time. Children with ADHD often benefit from behavior therapy and counseling, which may be provided by a psychiatrist, psychologist, social worker, or other mental health care professional. Some children with ADHD may also have other conditions such as anxiety disorder or depression. In these cases, counseling may help both ADHD and the coexisting problem. ADHD versus ADD. So you may have heard both the terms ADHD and ADD when talking about this disorder, and you might have been confused on what the difference is between the terms. The major difference between ADHD and ADD is basically nothing. ADD, or attention deficit disorder, while an outdated term, is still used to refer to ADHD, so it is the same thing. However, the term ADD is missing the hyperactivity part of ADHD, so do not be confused when you hear both terms being used. So let's review what we have learned about ADHD. We have learned that ADHD is a very common disorder. It can be caused by many things, whether it be hereditary, genetic, maternal drug use, environmental, or developmental. It has a variety of symptoms, whether it be relating to inattention, hyperactivity, and impulsiveness. It can be prevented if the right measures are taken. While there is no cure, it can be managed and there is treatment available, including medicine and behavior therapy and counseling. This is a serious disorder, and if someone you know and are close to has it, be nice to them. Don't blame them for their behavior or get mad at them as much. Just talk to them and things can turn out better. But hey, it's just a video, a science video. Thanks for watching.